Hello, my name is Guna Reddy-Kolanu. I'm an ENT surgeon. I'm an ENT consultant at Surrey and Sussex Healthcare Trusts. I'm the lead clinician for the department, so I sort of run the management of the department as well. I also offer private services as an ENT surgeon at a few sites, including Gatwick Park Hospital and North Downs Hospital. I decided to become a doctor, I guess, partly because I was interested in the technical aspect of it, the science and the medicine. But again, I guess there's got to be a fundamental nature of needing to care and help people. And I think that's very central in all doctors. It's a very personal relationship you get with patients. And I think that's something I've always enjoyed in knowing people, not on a superficial level, but on a very fundamental level. And as patients, you can get to know them this way, particularly patients you see over the years, and particularly children who you see grow up. It can be a very rewarding experience. I sometimes wonder why other people don't specialise in ENT. I would argue it's one of the most pleasant specialties to work in. You work with a whole range of patients, from young children all the way to the elderly. There's a vast range of problems you get to see. So you get to see problems where you can offer surgery, you can get to see problems where you just manage it with medical therapy. With surgery, there's a whole range of operations available. So as a technical specialist, you get to use a huge amount of different equipment, and that can be hugely rewarding and allows you to maintain interest in the job long term. Well, I guess like many people in modern society, I was born in India, in fact, but came to England when I was a very young child. And my dad's job moved a little bit, but most of my childhood was in the very edges of London, so suburban London, towards North London. And I guess I've very much seen that area as my home throughout my upbringing. The thing I found most rewarding is often when you get to make a relationship with patients. And with these patients, they're not always the most straightforward patients, because of course straightforward patients you treat and they move on. But it's patients where there's a lot of work involved in trying to get things right, where it's not clear cut what the diagnosis is, it's not clear cut how to work with them. But I think by being honest with them and working with them and working within the limits of what medicine can do, of the various ways you can help them, not only with medicine, I'd say, but also just by treating them as human beings, you can get a very rewarding relationship over the years. And I think you can make an impact on them, not only medically, but as a positive experience for them to take forward through with them in their lives as well. So when the thing that I think patients value most with me is I listen to their symptoms very carefully, and not only their symptoms, but how it affects them personally. I take all aspects, not only very specifically with the ENT condition, but how it interacts with their day-to-day lives and how it very specifically affects them. And I tease apart every single aspect that they bring to me, because clearly they brought it to me because it's important to them and they feel that it's part of the problem. I explore those areas, and then I very systematically go through the things that we can offer to make things better on every single level, both starting with simple counselling, moving on to medical therapy and surgical therapy, and indeed giving them the option to take their own time and make their decision, and get the decision as right as they can for them. So I think that's what patients value about me, and I think it's very similarly mirrored in return, in that I want patients to be very honest with me in what bothers them, because it's only that way that I can actually help them, because I don't want them to talk around the subject. I want them to be clear cut in what bothers them and what I can do to make their life better, be it advice or be it something much more medical. Okay, the challenge in the ENT are partly purely surgical. So some of the surgery is very detailed and it takes a lot of time to do very carefully. But when you attention, you do get good results. And I'm very conscious of that, being experienced and having done the operations many times. So that's on a technical level, but the other challenges are getting the treatment right for the patient. And sometimes getting the treatment right is just listening to them and listening to their concerns and going on a journey with them, exploring all the different treatments and taking them through the course that works best for them, for their condition and how it affects them. In difficult situations, you need to be very organized in your thoughts, I'd say, because situations are normally difficult when there's a number of factors going on, and you can only really help if you acknowledge all the factors and work with every single one of them. I think by that way, you can come to the best possible result without being overwhelmed. The three adjectives I'd use to describe medicine: one is hopeful, is to give hope to patients with the outcome. Secondly is honesty, be honest about the various conditions and what you can do. And the last one is joy, because you can get a lot of joy from the profession, and indeed patients can come out with a very positive, joyful experience when things work well for them. You know, you can see parents and patients who've come through conditions and they are truly happy. Their life really has changed, and I think that's an experience of joy both for the patient and for the surgeon.